Tisha.
Good morning.
Glad to meet you. What area or areas of nursing are you interested in and why?
I'm primarily interested in GI nursing, something that I'm comfortable with and that I've been doing for about 14 years now.
Well, tell me about your clinical experiences. Which rotation did you enjoy the most and why?
My clinical experience was completed at Penn State Hershey Medical Center. It's affiliated with Penn State University. I was very fortunate to get that clinical rotation there. I completed my psych rotation in the emergency room. Typically, hospitals like that have a specific area for psych patients, but Hershey does not any longer. So their psych patients go to the ER in specific lockdown areas. And I also completed my PEDS rotation at the Children's Hospital at Penn State Hershey. And then I completed my med surge in the emergency room.
What is the biggest mistake you ever made and how was the problem resolved?
Probably the biggest mistake that I ever made over the course of my career so far has been a med error. The one med error that stands out the most, I only actually ever had two in my career, but the one that stands out the most was something that really could have been prevented. It was a med error that took place because of the way the medications were stored in the cart. I had two patients with the same last name. They were both Alzheimer's patients who could not identify themselves. I was familiar, however, with the patients and who they were, and actually didn't even realize that I had made the error until I had come back and pulled the medications for the next patient, which also had the same last name, and then realized what I had done. Fortunately, there was no harm done to the patient. The patients did receive the same exact medications, which was very, very lucky to at least to have the same medication, but the one dose was slightly higher, so I did need to contact the nursing supervisor, and then I also needed to contact the primary care physician, which handled it very, very professionally with me. We reviewed, process improvement and so forth, and I, continued to monitor the patient. And like I said, there was not an adverse outcome. I learned a great deal from this. I would have to say I'm very conscientious when it comes to med administration. I thought I was then too, but it's something that I definitely learned from.
Okay, tell me about yourself and what do you see as your strengths and why?
I would have to say that I have nearly 20 years experience as an LPN, so I would have to say my biggest strength is my skill set and the years of experience under my belt. I feel like I'm very conscientious, I'm reliable, I'm trustworthy, and I have a lot to offer, a lot to bring to the table.
Good. How about your weaknesses and why?
Probably my biggest weakness is delegation. I have a hard time delegating tasks that I feel I should probably be completing myself. Not necessarily because it's the role that I'm in that I should be completing them, but just because it's my assignment. I tend to not rely as much as what I maybe should on my coworkers as far as helping me out. Although I'm the first to be there to help them out, I guess it's something that I need to work on.
Tell me about a staff nurse who most impressed you and why.
Well, there's been many staff nurses that I have had the opportunity and pleasure to work with who I've also gained a great deal of knowledge from. The one that sticks out in my mind the most is a fellow GI nurse that I worked with about 5 years ago. She was very much an experienced nurse outside of GI, but also had about 15 years of GI specific experience. Taught me a lot. She was very compassionate. She was extremely organized. She could make a very uncomfortable patient comfortable in a matter of seconds. She just has a knack for nursing. And I feel like just by watching her skill and her approach with patients, that it has made me realize areas that I can perhaps improve upon myself.
How would your most recent nursing instructor describe your performance in a clinical setting?
I would think that they would say that I was very organized, very motivated, always looking to complete skills. Anything I could get my hands on, I was volunteering to do. Even if it wasn't on my patient specifically, it was something I needed to complete. As far as my skill checklist, I was doing it. I would think that she would say that I was very conscientious as well.
Well, tell me about your most challenging clinical assignment and what you learned from it.
Definitely the most challenging clinical assignment that I had was during my psych rotation, which again was in the emergency room at Penn State Hershey Medical Center. I had a paranoid schizophrenic patient that was actually brought in by the police. She was pulled over traveling in excess of 100 miles per hour, highly paranoid. I had a very hard time establishing a rapport with this patient because she was also very paranoid about me and my interactions with her. I have to say that I was very uncomfortable in this situation. I really felt like I didn't have the experience that I would have liked to have had dealing with patients like that. So it was rather challenging, and it was something that I was able to identify that I needed to, read up on more and gain more knowledge and more skill as far as how to approach those types of patients.
What skills do you feel you have gained from your past work experiences that may help you in this position?
I feel like because I have so many years of GI experience and knowledge, I feel like that'll really help me in the position that I'm applying for. I also feel like because it's such a fast-paced environment at times, and also at times we have very, very sick patients who are very critical, and I've had to, on a daily basis, multitask and prioritize. And so I feel like with those years of experience, it'll only help me in my next endeavor.
Okay. Tell me a little about yourself and how would others describe you?
Well, I am married. I have one son who is about to graduate from college, and I enjoy the outdoors. I would say that others would describe me as being a very caring person, and also that I love the field of nursing. I am very open when I talk about my career, and there is not anything that I can think of that I would rather do.
What are your future career plans? Where do you expect to be in 2 or 3 years or in 5 years?
Well, in 3 years' time, I plan to have my bachelor's degree. I figure by the time I graduate my associate's degree program, it'll take me an additional 2 years to complete my BSN. That is really probably as far as I really want to go in my education. I don't know that I really want to get into a master's degree program. I very much enjoy hands-on nursing care, and that's what I plan to do for the rest of my career. I don't see myself being in a management role. Maybe a floor charge nurse would be okay, but I think in 5 years' time, I plan to be working in a very busy GI practice, ambulatory care, maybe perhaps in a charge role position.
Well, we do not have any openings at the present time in the area in which you have indicated an interest, but would you be willing to accept a position in another area? And if so, what areas interest you?
The other area that I think I'd be interested in and that I might consider a position would be in the emergency room. Basically because my clinical rotation, I highly enjoyed it. There was a variety of patients that you see on a daily basis. The adrenaline rush that you get, which is one reason why I like GI so much, you get that on a daily basis in the emergency room as well.
But tell me about a time when you had to establish priorities during one of your clinical experiences.
I would have to say that every single day I have to establish priorities. I can't really say that there's one time where I haven't. There's always a priority. Some are just bigger than others. If I had to specifically say one time, I would say probably whenever I had a patient who was just brought in from another hospital who had recently had a STEMI and a CVA. I also had a patient at the same time that was experiencing a GI bleed, although it wasn't a brisk GI bleed. My priority at that time